Well, now all this week hearing about how our health service is changing for the better and sometimes for worse.
One area of medicine that's seen amazing developments in recent years is surgery. Improvements in techniques and technology have revolutionised the way many operations are carried out.
At one hospital in the south, they're now carrying out hip operations where patients can go home just 2 days after surgery. Christine Alsford's been finding out more for tonight's Meridian Report, and her report contains some footage of the operation.
That's been one of the big problems of
Lillian Clay is about to undergo a full hip replacement at Southlands Hospital in Sussex. Surgeon James Lewis has come to talk to her about the operation, which will leave her with just a small scar and uses advanced techniques that will vastly improve her recovery time.
This is the socket which is coated with bone minerals. And once that's bonded, that then stays there for life. And
well, I've been told that it's very less invasive, so that they don't have to open up a long wound. It's only about 3 inches apparently, and also they don't have to cut into the muscle, which makes recovery very, very fast compared with the old way.
In recent years, 72-year-old Mrs. Clay has been experiencing increasing pain and problems with mobility. The operation is the only solution.
Pain tells you that something's wrong. Movement of the leg, you can't move it to the side.
And you haven't got long before you go down. You're a bit nervous?
I am a bit nervous, yes. But I think, well, you don't know anything about it, do you? So when I wake up, it'll be over.
The standard incision for a hip replacement is around 7 or 8 inches, but around 4% of hip operations are now being carried out with the techniques being used on Mrs. Clay. A cut just 3 inches long is needed, and the ball and socket that's put in actually fuses with the patient's own bone, reducing the chances of having to repeat the operation in 10 to 15 years' time.
Traditionally, to do a hip replacement, we as surgeons have lifted up the muscles to get down to the deep hip joint. We can now do it through a small skin incision, but the important thing is on the inside there's very little muscle damage, and we can now do it without cutting any muscle and really going between the muscles.
What impact does that actually have on recovery times and rehabilitation?
In the short term, in general, patients have less pain, and in general they walk more quickly. Most patients are walking indoors without sticks at 2 weeks and walking outdoors without sticks at 4 to 5. A traditional recovery would be more towards 3 to 6 months.
A few hours later, Mrs. Clay is out of recovery and back on the ward. And much pain?
Very little. Very little.
Just over 48 hours later, she's not only up and about, she's preparing to go home. And 1 week on from surgery, and Mrs. Clay's recovery is exceeding even the most optimistic predictions.
Yes, I'm walking with no sticks at all, and that's a week after the operation. I knew that recovery was going to be a lot faster, but not this fast. I think it's absolutely amazing. Everybody who's come or has come to visit me, they can't believe it. Well, it's just been wonderful.
Not everyone is suitable for the new technique. It can't be used on anyone who's overweight. But in time, surgeons believe it will be used more and more widely. And because it gets patients back on their feet and out of hospital so much more quickly, it could also help cut waiting lists. Christine Alsford for Meridian Tonight.